Hi everyone, I'm Dr. Joseph Nyandraj and this is Dr. Logic 360 where your health gets smarter and simpler. Some people have normal cholesterol and still get heart disease. Today I'm going to show you 5 blood tests beyond bad cholesterol that can reveal your heart risk much earlier. So stay tuned. Imagine your heart arteries as a highway tunnel. Fat and cholesterol can't travel in your blood by itself. So they ride in tiny trucks called lipoproteins. So these lipoproteins are nothing but delivery trucks. You may have heard about lipoproteins called HDL, which stands for high density lipoprotein, and LDL, which stands for low density lipoproteins. HDL, which is commonly known as good cholesterol, and LDL, which is commonly known as bad cholesterol. So, HDL is the cleaning crew. They remove extra mess from the tunnel walls, which are the blood vessels in your heart. And the LDL are the riskier trucks. These trucks carry cargo, but too many trucks can crash into the tunnel wall. These LDL trucks have a protein called ApoB, which is like a sticky bumper tag. These ApoB proteins are also present in other lipoproteins called IDL and VLDL. So when ApoB is present in these drugs, it makes the cholesterol stickier and it gets deposited in the arterial walls, and over many years these could develop into cholesterol plaques leading to blockages and heart attacks. There is another important drug called lipoprotein A, which also carries cholesterol. The cholesterol which travels in the lipoprotein A are extra stickier and they predispose to premature heart attacks and strokes. And they also cause valve problem called aortic stenosis, which means restriction in the opening of the aortic valve in your heart. So LPA lipoprotein is one of the dangerous cholesterol carrying drug in your body. Sometimes this LPA can be significantly high in certain patients. These are genetically inherited. So how do doctors spot these troublemakers before the tunnel or the blood vessel closes? Let's start with test number 1. Most people only hear about LDL, which is the bad cholesterol. But LDL is not the only troublemaker. The blood test often gives you total cholesterol, HDL, LDL. From the total cholesterol and the HDL, you can calculate a number called non-HDL cholesterol. This non-HDL cholesterol will reflect all the bad particles or the cholesterol in your blood. Think of it like catching the whole team, not just one bad player. Even if LDL looks okay, non-HDL may still show your hidden risk of heart disease. Okay, now let's count the trucks by themselves. Because cargo is one thing, but traffic matters too. So next test is the ApoB. ApoB counts the number of riskier trucks or the riskier lipoproteins in your blood. So more lipoproteins with ApoB means more problem or more risk of heart attacks and strokes. So even with normal cholesterol and normal LDL, ApoB can still be high. So doctors often look at ApoB in people with diabetes, high triglycerides, and premature heart attacks or stroke in your family, and low LDL but ongoing concerns for heart attacks and strokes. But wait, what if the danger comes from your family? Let's talk genetics. Lipoprotein A, which is commonly called as LP little a. This is a special inherited lipoprotein. In certain patients, the numbers of lipoprotein A could be very high. These lipoprotein trucks make the cholesterol very stickier. High lipoprotein A can raise heart attack even when regular cholesterol looks normal. That is why many adults should check the lipoprotein A levels at least once in their lifetime. Now let's talk about something you can't see, which is inflammation inside your body. Doctors can test for inflammation in your body by a blood test called high sensitive CRP or high sensitive C reactive protein. The higher the inflammation, higher the high sensitive CRP. When the high sensitive CRP is high, the risk of your heart attack also increases. The next test is the triglycerides. Triglycerides are another kind of fat in the blood. Too high triglyceride also can increase your risk of heart attacks and stroke. It is often linked with too much sugar, sugary drinks, too much sitting, and lack of exercise and obesity. Lowering triglyceride also can help improve the traffic in your blood. So, what should you do? Ask your doctor if extra testing makes sense for you, especially if you have family history of early heart disease, diabetes, high triglyceride, past heart disease, normal cholesterol, but you still had a heart problem. So, friends, normal cholesterol does not always mean zero risk. Sometimes the real danger could be hiding. That is why smarter testing like non-HDL, ApoB, lipoprotein little a, high sensitive CRP, and triglycerides can help protect your heart before trouble starts. If you learned something new today, please hit the like button, subscribe, and share this with your family and friends, particularly with a friend who says my cholesterol is normal, so I can eat anything. Thanks for joining me. This is Dr. Joseph Nyandraj for Dr. Logic 360, where your health gets smarter and simpler.